So for this video, we're going to talk about the extension rotation test. Now, for the extension rotation test, one of the things that we are doing is we are trying to provoke symptoms. And so it is considered a special test or a provocation test. Specifically, it is utilized when it is the belief of the clinician that the individual is dealing with a facet issue, that being a facet arthropathy, or perhaps a closing restriction. And so for this, what we're going to do is we're going to ask our patient to slide all the way to the end of the table. And what this allows us to do is to approximate ourselves to our patient. Now, a couple things that we want to do. First is adjust the height of the table. I like the table such that it hits right above my knees. That way the patient is positioned well. The second thing is we need to think about the test just a little bit. Now, the test is called an extension rotation test. So the idea is that we're going to extend our patient and then we're going to rotate them. This is going to look a lot like a quadrant test that we did during our range of motion screen. Now, because of coupled motion occurring in the lumbar spine, we can also create similar motion by side bending and then rotating. Right? It gets us into a very similar position as the extension and rotation does. So there are two ways to perform this test. The first would be as it's kind of described, that being an extension rotation test. And for this, you want to be on the side that your patient is rotating away from. Right? So if I'm on my patient's left side, they're going to be rotating to the right, and I'm going to be guiding that. So for this, we're going to ask our patient to give themselves a hug here. I like to take and put my knee kind of behind their back to support them. I'm going to ask them to extend first, and then I'm going to guide them into rotation. Now the benefit of this is they're on my thigh. They're not going to go back any further, and so they can really relax into this position. All right? And so with that extension rotation to the right, we would be closing down ipsilaterally on the side that we're rotating towards, the right side. Now, another way that you can perform this test is with side bend and rotation. It tends to be a little bit more provocative though, and the reason for that is you're going to provide some compression to the facet joint itself. And the way this one is performed is first and foremost you're going to side bend them, and now you're going to be on the same side. So we're going to side bend our patient towards us and kind of lock in right at our sternum, right? And then from here, we're going to rotate them into that position. Now, as we're rotating, can also provide a little bit more side bend on the same side. Now, that's a little bit different than the way that the extension rotation test is defined, but by creating that extra bit of compression, right, axial load, we can also exacerbate those symptoms or reproduce those symptoms if we are struggling to find the comparable sign that our patient is reporting. So have a go with both of those variations, the extension rotation test, and let me know if there's any questions.